it's not an uncommon disease state. 72 million people in the United States have high blood pressure. And we know that there are certain traits or habits that cause it, and we can probably all guess them. These are called your risk factors. Just by virtue of getting older, a male is greater than 45, a female is greater than 55. And unfortunately, though, now with the epidemic of childhood obesity and earlier diabetes, we're seeing people in their 20s with very difficult to control high blood pressure, but generally, it's as we get older. Over half of all Americans age 60 have high blood pressure. But it doesn't have to be a routine part of getting older, and it certainly doesn't have to remain high, because there's a lot of things we can do to keep it at a normal level. Race and ethnicity also play a role. African Americans have higher rates of high blood pressure than Caucasians or Latins. And they tend to get high blood pressure earlier in life. A lot of reasons for that. It's often more severe. They're less likely to be aware that they have it. They have more difficulty achieving blood pressure control. We actually know now that there are some medications that don't work well in that population, so we have to tailor blood pressure therapy for everyone, but especially for different ethnicities. And they tend to have higher rates of premature death and complications from heart attack and stroke. If you're overweight or obese, you're at risk for high blood pressure. Overweight means that you have excess body mass, either from muscle, bone, or fat, where obesity just means you're overweight from excess fat. So there is a difference. I don't know if it's an important difference, but there's a difference. Gender, men, we're lucky. We're much more likely to have high blood pressure than women. Women are better at finding out that they have high blood pressure and getting treatment up to the age of 59. Turns out once women get to the age of 60, they're just as likely as men to be treated or be aware that they have high blood pressure. But if they've got to the age of 60 and they haven't been diagnosed yet, they're harder to treat because it's likely that they've had it for a longer period of time. And the longer you have it and it goes untreated, the more difficult it is to get it under control.